57-year-old Lucy Macharia would have been doing something else this afternoon if a friend hadn't convinced her to do the one thing she had been postponing for years, getting screened.
This morning a friend of mine told me that there is screening of cancer here, and so we agreed that after we were through with what we were doing, we could come here. That's why I have come. It's my first time.
She stands in line behind hundreds of Kenyans taking advantage of the free cancer screening at the Kenyatta International Conventional Centre, grateful that she has finally shaken off the fear.
I felt it was necessary to come. I have lost a number of relatives due to cancer, and so I felt it was important to be screened.
Her sentiments were being echoed just meters away from her at the 9th Stop Cervical, Breast and Prostate Cancer in Africa conference that brought together several of Africa's First Ladies, led by Kenya's Margaret Kenyatta, government health officials, professionals and stakeholders, all here to raise awareness about cancer in Africa under the theme Investing to Save Lives, the Role of Public and Private Sector Partnerships.
So far, we have succeeded in raising awareness about cervical, breast and prostate cancers among our African population. Now we must build on this success by increasing our efforts in expanding access to early screening, prevention, treatment, and palliative care services.
40,000 new cancer cases annually in Kenya, the heavy cancer burden that sees it ranked third among the main causes of death after infections and cardiovascular diseases. The government put on the spot over the provision of health services to address this concern.
Through public-private partnerships in Kenya, we are intending on setting up 4 special cancer treatment centers across the country to increase access to quality care.
At the periphery of the conference that will run from the 19th to the 21st of July, the many Kenyans who have turned up for the free screening is, if for nothing else, cognizant of the strides being made in raising cancer awareness in the country.
It's through the awareness that I'm here today. But treatment and the rest, okay, I'm not really exposed to that.
40% of all cancer-related deaths are preventable if diagnosed and treated early. And so even as we continue to hold the government accountable over health provisions, it is important to understand that it all ultimately begins with us. These hundreds of women who have come here for the free screening testament that it is a first step that should be taken by someone in finding out their status. Evelyn Omboy, Citizen TV at the KICC in Nairobi.